This is Dr. Sriman Narayana, surgical gastroenterologist and laparoscopic surgeon, Reno Hospital, Sanat Nagar. Coming to the investigation part of the chronic pancreatitis, if any patient coming to the clinic for the pain abdomen or this type of symptoms, first thing is we have to ask the history. History is more important than anything, and we have to exclude any other causes. And second thing is examine the patient. If you examine the patient, almost 50% of your diagnosis may come into the conclusion. So on examination, patient will note, examiner, like a doctor will notice some pain in the epigastric region. Epigastric means above your navel, some pain will be there. On pressing, some tender will be there. Coming to the investigation, proper investigations, first thing we'll go for the pancreatic profile, that is the amylase and lipase levels. If he has any very recent history of pain abdomen, the amylase and lipase values will be raised. Suppose this is the repeated attacks, even though amylase lipases are normal, that means amylase lipase means the pancreatic juices. Suppose the repeated attacks, your pancreas is completely damaged, even though you are getting the attacks, but our lipase, amylase lipase will be the normal. Because nowadays it is the very common in the net searching. So patient will tell, sir, our amylase lipase level is normal, but you are telling you have got the pancreatic attack. What is this? Pancreas, if the pancreas is got infected, that is injured, your amylase lipase levels will be raised. But if the already pancreatitis is damaged, even though it got attacked, your amylase level is normal only, because there is no production of juices from the pancreas. This is the blood investigation. And then coming to the second part is the liver function test. Why you want to go for liver function test is, our liver drainage pipe will be surrounded by the pancreas. So any attack of pancreas will cause narrowing of our liver bile juice, liver duct. So liver function test also will be raised. And third part will be the radiological investigation. One thing is the more common nowadays, we are using the ultrasound abdomen. In ultrasound, what more commonly doctor will see is what is the condition of pancreas and what is the condition of duct and any other side effects. Why I am telling all these things is, the treatment will change based on the findings. Because in pancreatitis attack, any diseases, we have to see everything, then only we'll decide. Because why I am stressing on all these things is, for everything is not the same treatment. Based on our injuries or our findings, the treatment part will be changed. So ultrasound abdomen, then followed by the CECT, contrast enhanced CT scan, to know what is the condition of our pancreas, what is the condition of pancreatic juice duct, what is the condition of small part of duodenum, and what is the condition of liver. So all things will be correlated in the CT scan. Some patients will ask every time, this is the problem is, some patient, why you want to go for ultrasound, then again CT scan. Ultrasound will shows the basic knowledge and CT scan shows complete 3D picture. So almost every patient, most of the patient will go for the ultrasound followed by the CT scan. Okay, but we can't overshoot, we can't undershoot also. So after CECT, we noticed, after CT scanning, we noticed, okay, this type of pancreas is damaged, how much gland is there, how much is damaged. Then what about the duct? Is the duct is normal or duct is damaged? What about the any side effects of pancreatitis? Like our small part of bowel will get narrowed, will get injured, or sometimes our liver tube will get injured, because all three will changes our treatment plan. And sometimes may go for MRI also, what we call it as MRCP. So many patients will, why sir again CT scan, why you are going for MRI? MRI will shows the proper duct. Duct means liver drainage tubes, pancreatic drainage tubes, what we call it as a ducts. So based on ductal structure, our treatment plan will be changed. So few patients may need MRI also. So CT scan, MRI are brothers like thing. They are not, suppose if you go for MRI, no need to go for a CT. If you go for CT, no need to go for MRI. Not like that. Both are contemporary. Some findings are very good in the CT, like the stones and the pancreatic structure. And some, like a few patients may need MRI, like to know the how is the duct. Duct means drainage pipes. So both are contemporary. They are useful for Some patients, they are both are using for both. Okay, and sometime some very few patients may need endoscopic ultrasound also. Why you want to go for endoscopic ultrasound is, just like a endoscopy, our like a ultrasound probe will directly touch our pancreas, so to know the exact structure also. Sometimes small stones will be there that will not identified by the MRI or CT scanning. So few patients may need endoscopic ultrasound also. Though as a whole, the patient may need most common is the ultrasound, second thing is the CT scanning, and third one is the MRI and endoscopic ultrasound. This is the step-by-step process. All patient we doesn't need all four. Some patient may need, some patient does need only ultrasound. So based on that, we have to decide. Okay, thank you so much.